This is Dr. David Blodgett reading the article, Ask Your Doctor If Sleeping is Right for You. It's my pleasure to welcome you to this special issue of Health Magazine. We've printed an issue of Health Magazine up to 3 times annually for the past 12 years, delivered in most homes to the 5 counties served by the Southwest Public Health Department. Our mission is to help you live a longer, healthier life, and hope our magazine has helped you access information that is reliable, interesting, and compelling. While prior issues have contained a wide range of topics, we realize the importance of taking a deeper look at factors that impact health the most. I spend most of my time as a preventive medicine physician trying to convince people that a little effort in high-impact areas will go further than dramatic efforts in others. The big 5 behaviors that will do the most good for the most people when lived consistently are: eat more vegetables and fruits, at least 5 servings every day; exercise moderately, at least 150 minutes a week, or half an hour a day for at least 5 days; maintain a healthy weight; don't smoke. If you smoke currently, dropping the habit can add years back onto your life. Sleep 8 hours every night. The ideal range for adults is 7 to 9 hours. This behavior is my most recent addition to the list, but may well be the most beneficial. In fact, living the other 4 habits will be much harder unless you have this one down. So the health magazine you're reading now is devoted entirely to sleep. I think most of us know that sleep is important. That's fairly obvious after not sleeping well after even one night. However, I also think most of us don't fully understand how important sleep is. I call upon my own experience as evidence. I made it all the way through medical training and well into my career before I took the time to evaluate the role of sleep in my own health. You probably know that medical training is an anti-sleep activity. Medical students and residents often work shifts that last over 30 hours straight. It's part of what is expected. Unfortunately, studies have shown that sleep-deprived medical workers are responsible for extra errors. What we've discovered is that good physical and mental health is almost impossible to maintain unless you are getting adequate sleep. Good sleep gives your body time to heal, and your mind time to process and store what you have learned and experienced. Poor sleep habits have been linked with chronic diseases, such as heart disease, cancer, obesity, and diabetes. Poor performance, compromised memory and decision-making skills, decreased academic performance, increased accidents, poor mental health, including increased depression, anxiety, and even violent behavior, and earlier death. My own realization about its importance has forced me to evaluate how I think about sleep. I found that I needed to make sleep a priority, which meant exploring what was keeping me from getting the rest I needed. Part of the problem was long-established bad habits. Sleep was often the first thing to be sacrificed in favor of almost any other seemingly worthwhile activity. The brain tends to respond to what you really want to accomplish. So I had to convince myself that better sleep was important. Truthfully, I didn't start to improve until I was able to focus and make it a priority. When 9 or 10 o'clock at night rolls around, I now wrap things up and prepare to go to bed instead of looking for one more thing to get done. There is a growing amount of research in sleep science with interesting findings. We present some of the most effective, doable recommendations in the following pages. However, it will be your decision to adjust your sleep lifestyle and give yourself the gift of a regular, good night's sleep that so many of us have neglected. Some suggestions may work better for you than others, and ideal sleep schedules need to be individualized according to the age, preferences, and other factors. While the tips we offer will help most people improve their sleep, some of you may have sleep disorders with underlying health conditions, which may require professional medical care. Insomnia, perhaps the most common sleep problem, has an intriguing antidote that has been found to work for most people, and it comes from the behavioral health realm of treatment. It's known as cognitive behavioral therapy for insomnia, CBT-I, and is based on the science of retraining how we think about sleep to get better results. Applying this principle to my own sleep habits, I first had to realize that I had given up the idea that I could actually sleep longer and better. Then I needed to convince myself that those perspectives were untrue and that it was possible to improve this aspect of my life. My hope is that you will take to heart these messages about sleep from this magazine. Number 1, sleep is critically important to your health and almost every aspect of your well-being. Number 2, about 40% of us are sleep deprived largely due to bad habits. Does this mean you? Number 3, there are methods you can implement or learn that will improve your sleep. Number 4, sleep can be a complex issue that requires patience and a thoughtful approach on your part. I regret that I spent so many years denying myself adequate sleep, but making some simple changes in my life has worked. I feel better now than I have for a long time, and I think you will too.